So, hello everyone, welcome and thanks for joining CatholicCare's Talking Problem Gambling New Treatment Options webinar. My name is Jonathan Melrose Ray and I'm the General Manager of Community Engagement at CatholicCare Sydney, and I will be your moderator today. I would like to begin by acknowledging the Aboriginal peoples of the nations on whose lands we are meeting today and pay my respects to their elders past, present and emerging, and thank them for their stewardship. I'm talking to you today from the Gundungara lands down in the Southern Highland. Now, please let me introduce to you our speakers. First up is Dr. Christopher Hunt. He's a clinical psychologist and senior clinical supervisor across the Gamble Aware program throughout Central Sydney, Western Sydney and Southwestern Sydney regions. He has been working with problem gambling through the University of Sydney's gambling treatment program since 2007. He obtained his PhD in the psychology of masculinity in 2013 from the University of Sydney and completed a postdoctoral program at the University of Trieste in Italy in 2014. He has presented research on a range of topics related to gambling and gender roles in Australian and international journals, and he has been published in a range of international journals. Welcome, Dr. Hunt. We're also joined today by Eva Lavie, who has a Bachelor of Social Work honours degree from the University of Sydney and an MBA from the University of New England. She has practiced as a clinical social worker in Sydney Hospital and community settings for over 20 years. Eva has experience in the fields of addictions, counselling, and has worked with children, individuals and families within a wide range of settings. Eva currently holds the position of Addictions Counselling Practice Manager for CatholicCare Sydney. And obviously, both of these people have achieved great things and are still only in their early 20s, because you both look so young on camera today and you have such great backgrounds. I'm blown away. Before we delve in, I have some housekeeping to discuss. Questions will be taken at the end. Please write them in the Q&A box found at the bottom of your screens. And this webinar is being recorded and we will share after the session. So coming back to our session, being a problem gambler can harm your health and relationships and leave you in serious debt. But there's evidence that gambling can be successfully treated in the same way as other addictions and harmful behaviours. And treatment and support options are available for people who want to stop gambling. So today we're going to be exploring how high quality, evidence-based psychological therapies are being used for the treatment of problem gambling behaviours. So first I will go to Dr. Hunt. Good afternoon, Dr. Hunt. May I call you Chris?
Yes, thank you. Thank you for having me.
Thank you. Welcome. So, my first question is, what is problem gambling and how common is it in Australia?
So problem gambling is essentially, it's a bit broadly defined, but essentially it's when someone's gambling is causing problems for them in other areas of their lives, whether that's financial problems, work problems, relationship problems, educational problems, health problems. So it's quite broadly defined, but the sort of issues that we tend to see are things like, people gambling more than they intended to, people gambling to escape from their problems, people chasing their losses, people lying to their loved ones about their gambling. They're the key signs that someone might be developing a gambling problem. In terms of how common it is, so the numbers are generally quite consistent, that we see roughly 1 to 2% of the Australian population has a gambling problem. And then a further 2 to 3% are gambling in a way that puts them at a risk of developing a gambling problem. So we're talking about, several hundred thousands of people with a gambling problem in this country, and up to 1 million people at risk of developing a gambling problem.
Wow, that's big numbers. You mentioned an expression just then, chasing losses. What do you mean by chasing losses?
So chasing losses is essentially what happens when someone's gambling and they lose a lot of money, more than they intended to. And rather than sort of, I guess, accepting that loss, they decide, well, I'm going to go back the next day and try and win it back. Usually they end up winning more, and it sort of compounds that the losses that they're experiencing. But that's really what chasing losses is about. It's, when you lose money, trying to win it back. And it's something that I guess differentiates gambling from say, drug and alcohol problems, because it's quite a unique behavior that you see in gambling.
I wonder if you could That's a really interesting point. I wonder if you could expand on that and talk to us about the difference between gambling addiction and other addictions.
Yeah, I think in a way the main difference between gambling and sort of drug and alcohol problems is that with drug and alcohol problems, when you drink, when you take a drug, you sort of there's a distinct relationship between how much of the drug you take and the effect it has on you. So if you were to drink, having one glass of wine is going to affect you less than having a whole bottle of wine versus having 3 bottles of wine a day. And it's sort of that straight line of that impact, that the harm that you see is directly a result of how much of the substance you take. Whereas with gambling, whether it's putting a bet on at the tab, whether it's pushing a button on a poker machine, whether it's watching a roulette a spin, every time it happens, one or two things can happen. Either you win or you lose. And the impact of those different outcomes on the individual is not the same. When you win, obviously you have more money, but also your mood tends to go up and your self-esteem tends to go up. Whereas when you lose, you have less money and are dealing with financial problems. But on top of that, it also impacts your mood quite directly, and it can have a direct impact on someone's self-esteem. So when someone loses, they come to us and they say things like, I'm an idiot, I'm so stupid, why am I doing this again? And so gambling, I guess, the technical term is it's a bivariate behavior. Like you engage in the behavior and one of two things can happen, as opposed to something like drugs and alcohol, which is more of a linear behavior, if that makes sense.
Yeah, that's an excellent explanation. You mentioned a couple of harms there in terms of the direct loss, financial loss, and the decline of self-esteem. And what other harms are caused by problem gambling? Obviously, if this continues, is there more? What happens next?
Well, the primary harm we see in problem gambling is usually some sort of financial difficulty. So when someone is losing a lot of money gambling, the first way it comes up is usually that they're finding it difficult paying their bills on time. They're finding it difficult to socialize because they can't afford to go out as often. They're finding it difficult to pay school fees, pay their mortgage, pay their rent. And that's usually the first sign that maybe they're spending a bit too much time and money gambling. But from that, you can see all sorts of difficulties flowing. So difficulty with relationships, particularly if trust has been broken because someone has been gambling when they've been saying they're doing something else or using money that they shouldn't have been using. We can see difficulties with work. If someone is quite anxious or depressed because they're gambling, that can affect their productivity at work. We can see similar problems in educational areas. Sometimes, as I said, when you lose money gambling, it can impact your mood and your self-esteem. So if that happens often enough, then that can lead to depressive-like symptoms. It can lead to anxious symptoms where someone's constantly worrying about how am I going to pay the next bills? What if my partner finds out? What's going to happen next? And at the more extreme examples, we see people turning to thoughts of suicide because they can't see a way out of their problems. Or sometimes turning to crimes, usually white-collar crimes, as a way of getting money to pay back some of their gambling losses.
Okay, thank you very much for that. And will you tell us about the stepped care treatment model and what's different about it? When we were talking about in the opening, we were talking about successful therapies, and I believe that's one of the treatment models you use, the stepped care.
Yeah, so step care is something that it's quite new to what we're bringing to the gambling area right now, and it's something that has been used for quite some time in other mental health services. And essentially what it's about is tailoring a treatment approach based on the need of the client coming in. So for example, I've had a relatively recent client. He came to see us after he had committed fraud at work and lost his job as a result of it. His wife also recently just found out about that. So he was experiencing quite significant conflicts in his marriage. And he was also struggling to pay back his bills. So someone like that needs quite a lot of support. So as well as coming to see me for individual counselling, we were also referring one to legal services that are set up to be quite specialist for the problems that gamblers have. We referred him to financial counselling to help him discuss how he can repay some of his debt. There's also the options of relationship counselling as well if he feels that he needs that with his partner moving forward. So it's about providing a large suite of services for those with more complex needs. But we do have people on the other end of the spectrum who, you know, maybe they've only been gambling for, say, 6 months up to a year. They haven't got large amounts of debt yet. They're quite new to it. Maybe they're younger. They're not quite feeling comfortable with coming in for individualized therapy. So for people like that, we have, you know, less invasive programs, which could involve, you know, giving self-help materials combined with occasional phone calls with a therapist that might be, you know, half an hour a week or something like this. So step care is really about tailoring the approach to meet the severity of the case in front of you. So it's not a one size fits all approach. Mm-hmm. It's very much for those that need more supports, we have those additional supports available. And for those that need a light touch, we have light touch options available as well.
Excellent. And how do people access the model?
So you can access treatment throughout New South Wales through Gamble Aware. So if you go to the website gambleaware.newsouthwales.gov.au or contact the hotline on 1-800-858-858, they can direct you to services that are in your local area because they are available in every corner of the state.
Excellent. Thank you very much, Dr. Hunt. I'll stop you there for a moment and I'll just move across to Eva. Good afternoon, Eva. How are you?
I'm very well, thank you.
Excellent. Thank you very much for joining us today. One of the questions that comes to my mind in terms of gambling addiction is, are there any groups of people who are at more risk of developing gambling problems?
Yes, actually, research actually shows that those who are economically disadvantaged, unfortunately, are more likely to experience gambling harm. There has been a link between gambling harm and domestic violence as well as correlating gambling harm with mental health and drug health conditions. So there are a few factors that are correlated with gambling harm. And in terms of culturally and linguistically diverse populations, research also has shown that some cultures are more represented when considering gambling harm in certain areas of Sydney, such as southwestern Sydney, for example. The research showed that there are cultures such as the Vietnamese-speaking community, culture, the Arabic-speaking communities and Chinese language-speaking communities are more represented when when gambling harm was researched. There is also a focal point on our Indigenous Australians and young people who also have been identified as vulnerable populations when it comes to gambling harm and the overall impact.
Thank you very much. And in what ways is CatholicCare supporting the delivery of the stepped care model that Dr. Hunt had previously talked about?
Right. The stepped care model is about client-centered and client-led interventions. And CatholicCare can provide clients with a wraparound service approach by making internal referrals to other programs within the CatholicCare Sydney organization, which is very advantageous for clients since they would have like a one-stop shop, so to speak, if they are requiring a number of interventions. For instance, we can provide mental health interventions, relationship counseling interventions, family support, domestic violence, drug health and financial counseling, as well as gambling counseling, of course, among various others. We have a program called Parent Line that assists parents, as the name says it, and it's a Carers New South Wales line as well, which helps those who are caring for others in various ways. It would be very much a client-led, client-centered approach, and very much in consultation with the person and their presenting issues in terms of what kind of service will be offered to them.
Excellent, thank you very much. And we've talked we've talked about stepped care and support around the person with the gambling addiction. Could you tell us how you are supporting the families with problem gamblers? Because I understand that there can be quite significant impacts on the household and family members as well.
Certainly, certainly. We have counselors in all regions who will provide services to the person engaged in gambling behaviors, as well as their family members. So a family member, a partner or friend of someone engaged in gambling behaviors can access both therapeutic and financial counseling services at CatholicCare Sydney. So we have, for instance, a family recovery service which provides therapeutic group work for children and adolescents and who are being negatively impacted both by drug and alcohol and gambling activities in their family. So this is hugely useful for young people, of course, as you may understand. And we provide, as I said before, a number of approaches. It's very much a systemic and holistic approach. And I brought today a very much de-identified example. So I'm purposely quite vague in terms of perhaps noting the country of origin. I'm just going to say African born, but that's not to negate the richness of the cultural experience. Is more in the spirit of de-identifying. So we have a good example, I think, that may illustrate this sort of wraparound step care service in supporting families who are experiencing the impact of gambling harm. So we had an African-born 24-year-old single mother of two who was referred for financial counseling due to her experiences of severe financial hardship. It transpired that as part of the domestic violence, as part of being in the context of domestic violence, her now ex-husband or her then ex-husband exerted coercive control over the client by directing her to take a loan in her name to pay off his own mother's home mortgage. The background context is that the client's former partner was also actively engaged in addiction and problem gambling behavior at the time. On the other hand, the client was working very hard, attending 2 jobs in order to make ends meet, as well as caring for her 2 toddlers and her sister, who was at the time, unfortunately, terminally ill with cancer. Therefore, yes, therefore, the family was simultaneously experiencing a number of coexisting psychosocial stressors, understandably causing the client and her children high levels of distress. And so her ex-partner wasn't honoring that initial arrangement or that agreement that he promised her. You know, he directed her, or in a way she did this during duress in terms of, you know, accessing this loan, and somehow obviously he didn't honor that. So she was left with to meet the repayments of the debt alone. After the financial counselor assessed the situation, she was also referred for gambling counseling and for mental health and psychosocial support, while she assisted, and the financial counselor simultaneously assisted the client with addressing the debt and its implications. The client also had access to family support, parenting and care services provided by CatholicCare Sydney. So in conclusion, and as a direct result of the financial counseling intervention and the gambling counseling intervention, the creditor eventually agreed to waive the debt of over $30,000. Yes, and the client is, I'm happy to say, is now debt-free. She works part-time, so instead of working at 2 jobs, and lives free of violence at an undisclosed location. She has reported feeling very grateful for the wraparound holistic support provided by CatholicCare at a time of extreme need for her and her family and her children. So yeah, I think this example illustrates that sort of wraparound support service that CatholicCare can provide. And the main client wasn't herself engaged. She wasn't engaged in active addiction or gambling or yeah. So she just this person and her children were mostly impacted by someone else's behavior.
Yeah, which I think is from what I understand, it's not I mean, that's that's most likely.
It's not uncommon. Yes, unfortunately.
Unfortunately,
Jonathan,
it's not uncommon.
it is very true.
Thank you for sharing that story with us, Eva. I'm going to go to the questions from the floor, and I have two at the moment. The first question I will go to is a little lengthy, but I'll read it to you. Do we accidentally create barriers to help seeking when we only talk about extreme harms from gambling, problem gambling, when people at risk might experience stress, anxiety, family difficulties, but not to the extent that is normally described? So they think they don't have a problem, so they don't need help support. I guess.
Sorry, is that the end of the question? Or?
That's the end of the question. Sorry.
No, I think that's a really good point, and I guess that's really what the step care model is really all about. It's about, and I think definitely in a lot of the more recent advertisements about encouraging people to come into gamble-aware services, they've sort of really taken note of that, and so some of them are aimed at that sort of more severe end, but some of them are going to be aimed at this sort of lighter end, I guess, that the question is sort of asking about. And I guess promoting the step care approach is about promoting that exactly, that it's not that, yes, these more extreme examples are what we can see, but there is something for everyone in gambling help services, wherever you are with your gambling problem, and sort of putting more awareness out there of what that sort of, I guess, lower end of the spectrum looks like, and what sort of helps and supports are there for people at that lower end of the spectrum. That's really what this step care approach is about. And so it's also, I guess, also about tailoring the way we engage with communities at that level as well. So making sure that range of presentations and that range of treatment options is presented to the community.
So in that combination, that step care where you have the light touch is very preventative. So it's people going, oh, hang on, I'm going to be, before I get to a problem.
Yeah, definitely. And I would have to say, I've been working for 14 odd years in gambling. And when I first came to work here, very much most people we saw were in their sort of 40s with really long histories of gambling. Whereas now we're seeing people as young as like 19, 20, 21, which sounds concerning, but it's actually great because we have people that don't have these long histories of gambling, that don't have these really severe problems as a result of these long histories of gambling, that are coming to see us at that earlier point, which is really great. And I think that really speaks to the great work that everyone in this sector, from the counsellors, from the Office of Responsible Gambling, from community organisations like CatholicCare, have been doing at promoting the message of greater awareness of gambling and gambling related issues.
That's great. Thank you for that. I've got another question. Given the noticeable increase in TV advertising promoting gambling, especially relating to horse racing, has there been any approach made, or will there be, to government to stop such advertising, just as there was done with cigarettes or alcohol? It's a bit of a political question.
That is a political question. There were several government inquiries around that. We did put submissions to those inquiries, which are available for people to read if they want to look them up. But essentially, yes, that work was done when the governments were investigating this, and the federal government did make changes and some restrictions on gambling advertising. So I think that was about 3-4 years ago. So yeah, but there's always
It's a
yes,
bit of an evolving dialogue, isn't it? As
yeah,
the
it
evidence
is.
comes on board, the government takes more advice and it moves forward.
Yeah.
Another question that we've got from the participants is specifically related to the pandemic that we're in at the moment, and that is, how did COVID affect gambling behaviours?
Did you want to answer this one, Eva? Or?
Yeah, I can, and we can both contribute. There was a noticeable reduction due to closures of venues and clubs. So self-referrals and referrals by other agencies significantly decreased during lockdown. Yeah.
Okay.
Yeah. And that's what we saw too. So some researchers here at the university did do some work on this, and they found that most gamblers, so most forms of gambling were sort of shut down during the lockdown. So the pokies were shut, the tabs were shut, at least physically, and sporting events, at least in the first lockdown, were stopped. And we found that gambling as a whole did reduce quite dramatically. There was some increase in the sort of gambling that was still going. So that's things like horse races, but it was relatively minor compared to, you know, the decrease in people's gambling behavior when things were shut down. After the first lockdown ended, we did see a gradual increase to returning to close to pre-pandemic numbers. We haven't seen that just yet after the second lockdown, but we'd anticipate that that's what's going to happen. So people stop, and then when the lockdown finishes, they go back to it.
Okay. And my last question for you both actually would be, how would you recognize the behaviors of a loved one experiencing a gambling addiction? It's a broad one.
It is. I guess the first sign to be aware of is, you know, yes, you want to look for general signs that something's not quite right. So maybe it's in their mood, maybe that they're sort of being evasive when answering questions, maybe there's time in their day that doesn't really seem accounted for. But I guess the particular unique thing with gambling is if they, you know, if they don't have money to pay for things that they should have, if they're, you know, asking, can I borrow $20 just for petrol today, when you know that they should have been paid last week, you know, if they're asking for, you know, small amounts here or there, they're saying no to things that are costing money, that can be a specific sign for gambling. But just generally looking for, you know, irritable or depressed mood, sort of seeming anxious, sleeplessness, things like that.
Okay, thank you very much. So we're on 1 o'clock, so I'd like to thank our panelists for today, Eva and Christopher. Dr. Hunt, thank you very much for making the time today, and thank you everybody for joining us. Excuse me. CatholicCare services provide free counselling and support for gamblers and their families who are experiencing social, emotional and financial difficulties, and this program is available in a range of locations. If you or anyone you needs help, please contact the helpline on 1-800-858-858. For over 80 years, CatholicCare Sydney has been serving those in needs. Our services are designed to help people thrive and span a broad range of issues, including relationships, parenting, aging, disability, addiction, and mental health concerns. Many of our programs rely on donations and contributions from the community in which we operate, and we continue to seek support. There are 3 ways that you can help. 1, with a gifted donation or support of our work, or by referring our work to others who may be able to help and provide financial support, or by sharing the work with your community. Thank you for joining us today, and we hope you've gained some valuable insights from our speakers. You will receive a follow-up email with a link to view the recording from us very soon. So thank you, everybody. Thank you, Eva. Dr. Chris, thank you, and goodbye.
Goodbye.